Hi folks, it's Marvin Music with MedicareSchool.com, and I want to welcome you to our live event tonight. Let me explain real quickly the sunglasses. I had a detached retina surgery a week ago today actually, and so I was hoping that I could be able to do this without these sunglasses on, but I had a doctor's appointment this afternoon and they dilated my eyes, and there's just no way I can do it. So you're going to have to endure the glasses. But my retina repair is doing well, and I'm grateful for all that, but quite an experience. Anyway, so we're going to have this session tonight, so I hope you will not be too bothered by the sunglasses. And Daniel, maybe every now and then you can remind me to explain as people come in, why in the world does this nutcase have on glasses during that? So be sure to remind me about that, or if someone asks, just tell them I'm recovering from detached retina surgery. Okay, enough of that. We're glad that you've made this a part of your evening. Tonight we're going to talk about a supplemental plan. Before I get into it, just a reminder, if you're brand new to our company and our venue, please subscribe to our channel. We put out lots of content, great content creators within our company to teach about all things Medicare and Social Security. And so avail yourself of the many, many hours of things that we put together, the study that goes into it, and the preparation. We love educating people to make sure that when you go on Medicare, when you go on Social Security, you're doing it at the right time, following the right process, so you can have confidence in your choices around those two items. Tonight, I'll take any question you have about Medicare or Social Security. Happy to talk about that. Those of you that are already on Medicare, on Social Security, and you want to know about some of the changes that are occurring. Not all the changes are out yet, but I will be able to address some of them. So feel free to now, if you want to start putting your questions in. Daniel, our producer, will be fielding those here in just a few minutes. As I always say, please make sure we can understand your question. Don't be so abbreviated where we don't know what you want to know. So be sure that your question is very clear. And again, we'll go tonight for really up to about an hour and a half. Sometimes we don't have as many questions, but I'm usually tuckered by then, but we'd be delighted to answer any question that you would have. All right, so let's get into our topic tonight, and that is Supplemental Plan Gs, or they still the no-brainer Medicare choice. Now, what I'm going to do, just real briefly, let's kind of back up, and let's remind everyone that when we initially go on Medicare, and sometimes that's at 65 for those people that are no longer working, or they're on COBRA, or they're on an Affordable Care Act plan, or they're on TRICARE, or they're working for a small employer. That's the 5 groups of people that have got to go on Medicare at 65. So if that is you, where you have to start Medicare at 65, or if you don't have to because you're going to be covered by an employer-provided plan of you or your spouses, but you're going to go on Medicare in the future, maybe at 67 or 70 years old, or whenever you do that, when we go on Medicare A and B fully, meaning we're no longer covered by an employer plan, we basically have 3 options and ways that we can use our Medicare coverage. One is to do Medicare A and B only, nothing else. That, in my opinion, is the worst option to do that, because you have a tremendous amount of risk, a lot of financial responsibility, because Medicare is not going to pay anything 100% other than preventive services. So if you have A and B only, your coverage is 100% on preventive services, but everything else you would need, you are going to have to pay deductibles, co-pays, co-insurance. That's the biggest deal, that 20%. And so you have a tremendous amount of financial risk. So please, if you're watching this and even considering doing A and B only, I would highly discourage you from moving in that direction. If you have a serious illness, you absolutely will regret that decision. Now, the next option is to do A and B. Instead of taking on that financial liability, that responsibility, you actually can transfer that liability to an insurance company. So I have A and B that pays first, but because of the gaps that exist within the Medicare system, I can transfer that liability away to an insurance company. When I do that, I am buying a supplemental plan, also called a Medigap policy. There are actually 10 of those on the market today. The majority of people buy today either a G plan or an N plan. We're going to talk about that. But I want to make sure you know that's the second way you can use your Medicare benefits. About 40% of all people choose to do this. They use a secondary or a supplemental plan. 10% have A and B only, and the other half will enroll in the third option, which is called a Medicare Advantage plan. They also are called C plans or replacement plans. All those words are synonymous, but they describe using your Medicare through a private health insurance company that actually replaces Medicare for you, and you enroll into their health plan, their Advantage plan, and now they oversee, administer, and coordinate your care instead of original Medicare doing that. So A and B for me would never be an option, folks. So the next two options are still good options, but they're different options. Okay, so we're talking now about comparing supplemental plans to Advantage plans. And so the question is, will the G plan still be the top plan going into 2026? And so for those of you that are new to this whole system, as we talk about supplemental plan, there's actually 6 main reasons. 6 of these. And if you're going to take notes tonight, they're really simple, but there are 6 main reasons that people decide that they would prefer to use a Medicare supplemental plan versus an Advantage plan. 6 main reasons. The first one is providers. The providers that are available to you, meaning the hospitals and the doctors and the specialists. If you decide to use A and B with the supplemental plan, you can go to any provider as long as they take Medicare. There is no network with supplemental plans or original Medicare. If the provider takes Medicare, you can go where you want to go, which means you almost have unlimited choices. 100% of all hospitals take Medicare. 99% of all non-pediatric doctors take Medicare. Okay, so the whole point is you can almost go anywhere you want if you choose a supplemental plan. And that's one of the reasons people do that. Now, if you decide not to get a supplemental plan and you get an Advantage plan, that is still a fine option, but you're not going to have unlimited providers. Now, you will probably have plenty to choose from, but it's not going to be unlimited because Advantage plans work by way of networks, HMO networks, PPO networks. And so that's a provider that actually enrolls into a contractual agreement with that insurance company to provide care for their patients, either at a hospital or a surgery or a primary care doctor, and they get a certain financial reimbursement for providing for that service. So it's a network plan, totally voluntary. Providers do not have to enroll in those plans. Many will, but many will not. And so that is reason number one, people choose a supplemental plan because of providers. Reason number two, I take my glasses, I wrote all these down to kind of keep them in order. Reason number two would be predictable cost. When someone enrolls into a supplemental plan, and let's just use the G for instance, the G plan covers everything but one financial gap, and that is the B deductible. That is $257 this year. I don't know what it'll be in 2026, probably a little bit higher, but the B deductible is an annual deductible for anything on the Medicare B side, which is all doctor services and everything outpatient and all durable medical equipment. So you have this small deductible that you're responsible for the G plan, and out of pocket, you're done after that. You pay your premium and you pay this small deductible and you're done. So when I say predictable cost, you know exactly what it's going to cost you. You know what the B deductible is going to be. You know what your premium is going to be. And there's some people that like that. And I compare that to an Advantage plan. You do not know what your out-of-pocket expenses are going to be because the Advantage system is pay-as-you-go. So if you see a primary care doctor, probably zero. See a specialist, probably $50 copay. Go to the hospital, maybe $400 a day to go to the hospital. Have a surgery, probably $400 for a surgery. But the point is that system is pay-as-you-go until you hit a certain max for the year. Maybe $3,000, maybe $5,000. Maybe $10,000 max for the year. And so I like Advantage plans much better than A and B only, because with A and B only, you have no max. It just keeps going and going and going. At least with the Advantage plan, yes, you pay as you go, but at least there is a max. And some people are uncomfortable with that max. Maybe they have health problems. They're concerned about, what if I hit that max of $5,000 or $10,000? Because here's the fact, folks. Anyone who has a serious illness, studies have shown that you will spend more money on your Advantage plan with a serious illness because you have to pay as you go until you hit the max versus just simply paying a premium on a supplemental plan. All right, so supplemental plans have predictable cost. Advantage plans are reasonable, but not predictable because you're going to pay as you go until you hit the max. All right, so that's reason number two. So first one, we have providers. The second one, predictable cost. And then number three, permanency. So when we talk about a permanent policy, what I mean by that is that if you take a supplemental plan, it can never be canceled by the insurance company except for non-payment of premium. You pay your premium and that policy can never be canceled. It's also portable. So if you live in wherever, you live in Colorado and you move to Florida, take that policy with you. You live in Alaska and you move to Texas, you're going to take that policy with you because supplemental plans cannot be canceled because you relocated. They can't be canceled because of age. They can't be canceled because you're really sick and you have a lot of claims. They can't be canceled for any reason other than non-payment of premium. They are truly permanent policies. Compare that to an Advantage plan. It's a one-year plan. That's it. It's a calendar year plan. It's an agreement between Medicare, the insurance company, and you. And Medicare gives those companies the right to change those plans in any way they want. They can even pull the plan if they want. We're going to see a lot of that moving into 2026 as we see a tremendous amount of service area reductions. Service area, meaning there's going to be fewer plans going into 2026. Companies are pulling out of markets. They have the right to do that. That's not going to happen to someone on a supplemental plan because it's impossible. And so the point is, people that would like to have a permanent policy, knowing that policy can never be canceled as long as they pay for it, are going to, again, lean towards that supplemental plan. Okay, reason number 4. And that would be people that are concerned about pre-authorizations. Now, listen, all of you watching this tonight have been around long enough to know what that means. A pre-authorization means that your doctor doesn't have the final say-so. Rather, that doctor makes a recommendation to the insurance plan, and they have the final say-so, and many times they approve what the doctor recommends, but sometimes they don't. They can delay coverage. They can deny coverage. And so when you're on an Advantage plan, 27% of the services that you will need are going to have to be pre-approved by the insurance company. Trust me, you're not going to get a surgery, inpatient or outpatient, unless they agree. You're not going to get an MRI unless they agree. There's certain things they have to agree to, and sometimes they will, sometimes they don't. And so those pre-authorizations are a fact with Medicare Advantage plans. You will never encounter that with a Medicare supplemental plan. Now, Medicare has a couple of pre-authorizations, a few, not very many, but a few. But the supplemental insurance company, as long as Medicare pays, that supplemental plan will pay. They can never deny, they can never delay. And so the point is, there's people that like knowing that their doctor has a final say-so and not some kind of an insurance company. All right, then there's people that are really looking for what I just call quality, high quality, premium Cadillac insurance. In other words, that's what they want. That's what they want from their insurance. They want to know, they can go to any doctor they want, no pre-authorizations, a permanent policy, and they look at that and they say, I like the quality of that. Other people say, I'm not really, I want good insurance, but the quality is not the biggest deal. What I want is to make sure I can go to the gym for free, or I can get a little dental allowance, or I can get over-the-counter benefit. We call those perks. And if you're looking for perks, then that's going to be an Advantage plan. If you just want premium quality insurance, again, that's going to be the supplemental plan. All right. So these are the differences. And then lastly, it's this, and that is affordability. People that get supplemental plans have to pay a premium for all the quality of insurance. They got to pay a premium. And you have to be able to afford that. And so if someone can't afford a supplemental plan or doesn't want to, then they shouldn't try to do that. They ought to get an Advantage plan then. And all I'm trying to teach you is that as you go on Medicare or stay on Medicare, these are the aspects of the plans that you have to look at. But it all boils down to, sure, supplemental plans are awesome. I start Medicare in January. I'm going to have a supplemental plan. I can afford to have that. That's going to be in my budget. Some people say, I just can't afford it. It's too much. Well, then don't try to get it. We try to find you then the very best Medicare Advantage plan that we can. Now, back to my topic. Supplemental plans. Right now, about 60% of all people buy G plans, about 40% buy N plans. I think they're both very good options. There's a small difference in them. Number one, the G plan is the most comprehensive plan available today. If you're starting Medicare after 1/1/2020, that F plan is no longer available for you. So the most comprehensive is G plan. It covers 5 of the 6 gaps. 5 of the 6. What gap will it not cover? The B deductible once a year. The N plan, again, a good plan, covers 4 of the 6 gaps. Like the G, the N will not cover your B deductible. This year, that's $257. Again, I don't know what it'll be next year, but it's very minimal. And then the N plan also will not cover excess charges if and when those occur. That's when a doctor adds 15% to the bill. Now, frankly, it doesn't happen often. They say less than 5%, more like probably 3% of the doctors are actually even going to add excess. So it doesn't happen often. But if it did happen to you and you had an N plan, that extra 15% would be your responsibility. And then in the N plan, you have a couple of copays. G plan has no copays. You meet the B deductible, you're done. On the N plan, you meet the B deductible, you pay excess if and when those occur, and every time you see a doctor, primary care, a specialist, you're going to pay a $20 copay. Go to the emergency room, you pay a $50 copay. All right, so again, wonderful plan on the N, just you're taking on a little extra risk, not much, and a couple copays you didn't have on the G plan. So why do people do N plans? 40% of them, because the N plan is going to be on average somewhere between about $40 to $50 less a month, 40 to 50. And again, that varies. In some places it's even more, some places less. But the point is, if we take an N plan, we're going to save about $500 to $600 a year in premium. Yeah, you've got some copays and a small risk of excess, but it's still a very good option. All right, so again, I would tell you this. To me, if you can afford the G and you that's not going to impose any kind of hardship on your budget, and you're maybe concerned about excess charges, then to me, get a G plan. But again, if you're ever charged in excess, the doctors have to tell you in advance. There's 8 states where it's not even legal anyways, and so the likelihood is pretty small. And if you're willing to take on that small risk and a couple copays, then I think an N plan is a very, very good option. Okay, so I wouldn't tell you that today in this climate, either one of those plans are going to be more stable than the other. We have seen rate increases from both G's and N. Remember, everything goes up because of medical inflation. So I think it really boils down to if you're saying, hey, I would really like to save that $50 a month in my budget, then I would get an N plan. Or if you're saying, that's not going to make or break me either way, I'll go ahead and take the G plan. All right, so the whole point is this. If you decide to get a supplemental plan, listen, I've been doing this now almost 17 years. I think both of those are excellent options, G or N. You just have to decide what is most important for you as far as your monthly budget. All right, and so that's my advice on that. Again, I'm happy to field more questions about that particular topic, and we'd be delighted to spend time with you, just one-on-one with one of our agents, actually talking about the different premiums to make sure you're really aware of those differences in your particular market. All right, so enough of that, Daniel. I'm excited to take questions. I was not here last Thursday. Of course, my son and one of our sales managers took care of things. I'm glad they did, but I am ready and anxious to take the questions. I'm ready. Here we go. Pat, what is happening to Plan F and should we change? Well, nothing is happening to Plan F. Now, for those of you that are new to this, the Plan F used to actually be the #1 plan in America, and it was a full coverage plan. It was a plan that covered all the gaps. Remember how I said G covers 5 of 6, N covers 4 of 6, F actually covered all 6 gaps. People that were on F plans never got a bill other than they had to pay for it. And so what happened, though, there was a rule that we called the MACRA rule that passed in 2015, and they changed some of the Medicare rules with supplemental plans. And what they said with MACRA was there can no longer be a Medicare supplemental plan where it's full coverage. There has to be some out-of-pocket expense beyond the premium for anyone buying a Medicare supplemental plan, and they grandfathered in everyone who started Medicare before 1/1/2020. So if you started Medicare before 1/1/2020, which basically meant you were born before January 1st, 1955, then you could still get an F plan. January 1st, 1955 birth dates prior means you started Medicare or eligible for Medicare before 1/1/2020, then you could get an F plan, and you can keep the F plan the rest of your life. So if you're on an F plan, nothing's happened to it. It's not gone away. You can keep it. It's a lifetime plan. Remember, it can never be canceled other than non-payment of premium. So anyone starting Medicare after 1/1/2020, which means they were born January 2nd, 1955 thereafter, then that group cannot get F, but they can get a G plan or an N plan. All right, so nothing has really changed for the app plan other than I would tell you this: if it were me and you were my sister, I would encourage you that if you've been seeing some fairly steady or hefty increases on the app plan, if we can get you off of that and you can medically qualify, then I would then pick up a G or an N plan. Again, probably have to go through underwriting to make that happen, but again, you could call and talk to one of our agents and we can see if that's something that is possible for you. All right, let's keep going, Daniel. All right, I'm with Humana. Hope to get rid of them. My plan is a PPO. I've had them for 3 to 4 years. How do I change to another plan? G sounds good. I will listen tonight. Okay, thanks. Marion, sounds like to me that you're on a Medicare Advantage plan. And if you've been on it for 3 or 4 years, what happens is there's 2 times that you are given every year where you can return to original Medicare and then apply for a Medicare supplemental plan. All right, and those 2 times of the year are October 15th through December 7th, coming up really soon. Now, your Humana PPO plan is yours through 12/31, but you can return to original Medicare effective 1/1/2026, and you can apply for a Medicare supplemental plan. And you need to do that, though, right after October 15th. I mean, it's time, to do that because as people are getting off their Advantage plans and moving into supplemental plans, these companies are going to get backlog with underwriting. So we like to get those in as soon as possible. And we'd be delighted to help you make that switch. And so, again, the Humana plans through 12/31. So we go through underwriting and we would ask for an effective date on your supplemental plan of 1/1/2026. Now, there's a second aspect, Marion. Right now, you have an embedded drug plan as part of your Humana plan. That drug plan is part of the package. When you get a supplemental plan, you have to have a separate, or we call them standalone Part D plans. Now, you work with us, we'll set all that up for you, no problem. But what happens, though, technically, is when we've got approval on the supplemental underwriting, then we submit the Part D plan for you, and then what that does is that automatically kicks out your Humana Advantage plan effective 12/31. You don't have to call and cancel it. That drug plan will. So it kicks it out, and the drug plan goes into effect 1/1/2026 along with the supplemental plan. So that's kind of the technical aspects of making that switch. Give us a call, get on our calendar, and be delighted to help you do that. Okay, let's keep going. Okay, for those of you that are just coming in, let me tell you about the sunglasses. I had detached retina surgery a week ago. And I'm doing great. It's healing, but I had to go to the doc this afternoon, and they dilated my eyes, and everything is so bright it's crazy. So I had to wear the glasses. Okay, let's keep going, Daniel. I'm ready. All right, just received my Medicare and You 2026 book. My current Medicare plan Cigna doesn't show up in this book's plan for Utah section talking about drug plans. Can I stay on my plan? Well, not necessarily, Gary. What you should have in your possession any day now is what is called an ANOC. It's an acronym, ANOC, and it stands for an annual notice of change. So you need to be looking for that. If you don't have that by September 30th, here in just a couple days, then you need to call Cigna and let them know, hey, I didn't get my ANOC. And so the ANOC is going to tell you whether that plan is going to be available or not. Now, Cigna is going to have 2 plans in most markets, but what they've done is they've actually renamed their plans. And so your plan, I don't know if you're on, the Cigna like Value, their extra plan. I'm not sure what you're on. They had a couple of them, but you want to make sure if you find out whether your plan was crosswalked, meaning they automatically are going to enroll you into one of their other plans, a different name, could be a different premium, and so you want to pay attention to the ANOC because it'll let you know that. And so, again, I'm not sure exactly which of the Cigna plans you're on, but they are going to have 2 in most markets next year. So what I would do is this, couple things. Daniel, I think do we have that? Well, I don't think our website's up and running just yet for our drug plan. I'm forgetting the name of that. We just put this site together. I don't think it's public yet. But anyways, another thing you can do is you can go to Medicare.gov. And those plans should be up after October the 1st. We also have a site. Forgive me, I'm blanking on the web address on that. You can call in and we can get that to you. But the point is you can put your meds in and you can see what's available in your market. And this web tool will actually shop the different plans that are in your market and show you which plan is going to be best for you. And then you can also self-enroll. It's really very simple. It's about a 10 or 15-minute process. If you're our client already, Gary, then we would have given you, when we first started with you, some login information, username, password, so you actually can go into our site and make sure you're on the right drug plan. Let me give an advice to all of you. Don't assume because you're on a plan this year, you're going to like it next year, even if it's available. Formularies change, co-payments change. Lots of things are changing for the drug plans going into next year. And so there it says Medicare, there you go, MedicareSchoolEnroll.com. Use that website. We also had another one I was thinking about, but yeah, this would be a good one. And you can go in there, and if you don't have an account, then just put your username and your email address and create a password. Very simple to do. So those would be the ways you look at it. And again, they're not officially out yet. We won't have those plans up and running until October the 1st. But it is very timely for you. This is the time, the only time of the year you actually can change a drug plan is October 15th through December 7th, and then that new drug plan would go into effect January 1. All right, hope that helped. Let's keep going. All right, United Healthcare is dropping their Advantage program in Colorado. Someone told me that this means I don't have to go through underwriting to get off an Advantage plan. Is that true? Okay, here's what that means. That is true. So whenever they drop an Advantage plan, you have what's called a guaranteed issue right. Now, Deb, if you started Medicare before 1/1/2020, your guaranteed issue right in Colorado will be an F plan. If you want a G plan and you started Medicare before 1/1/2020, you can still get it, but you'll have to go through underwriting. Now, if you started Medicare after 1/1/2020 and lost your Advantage plan, then you would have a guaranteed right to get a G plan. And whoever tells you that, that's true. Now, you got to remember, you got to be able to afford it. Make sure the premium is comfortable within your budget. Now, also, if you did start Medicare after 1/1/2020, and your guaranteed issue would be a G plan, but if you want an N plan, you could do that. But again, you'd have to go through underwriting to obtain that. All right. And then so you look at the budget. Is this going to fit? And then you have to also have, remember, a separate standalone drug plan, because that Medicare Advantage plan you had with United Healthcare included a Part D prescription drug plan. Now you have to have a separate one of those. Okay, let's keep going. All right, what Medigap plan would you recommend for a veteran who uses the VA but isn't crazy about Advantage plans? Well, normally, if someone uses the VA and they have a really good benefit, meaning they have good disability through the VA and they don't typically go outside the VA, I don't recommend people get supplemental plans. Now, if money is no object, then what I would do is I open the session up with, I'd get a G plan or an N plan, either one of those. I wouldn't get an F today, even if you you started Medicare before 1/1/2020. F plans are just such high premiums today and not as stable as your G and N plans. So I would say a G or an N. Now, if you're using the VA primarily, then that's what you're going to have to decide. Is that extra money on a monthly basis worth it if you're not, probably going to use it? So that's why a lot of people in your situation will go ahead and enroll into what we call an MA only plan. That's a Medicare Advantage only plan. You get your meds to the VA, and the reason that veterans do that is because then at least they have some kind of a civilian option outside the VA to get a second opinion or to, whatever, any service you want. And you get some of the perks that are with the Advantage plan. And the biggest one is most of these MA-only plans for veterans and for TRICARE people will give you a reduction or a credit back towards your Part B premium, meaning they increase your Social Security check or they reduce your Part B direct bill. And so those are called give back plans. And some of those are $150 a month, $120 a month. So they're very attractive for people that are in your particular situation. Now listen, I've sold plenty of supplemental plans to people that had VA eligibility. Why? Because they could afford them and they wanted a good Cadillac option outside of the VA. All right, so that's my advice. I do a G or an N if you want to do that, if you're not comfortable with the Advantage. All right, let's keep going. All right, can you explain SCP and GI for when I move from one state to another? Yes. Okay, so I think what you're talking about, SCP, is you're referring to an SCP for an Advantage plan. And so what happens is when you do move from one state to another, the same would apply. You're able then to get a Medicare supplemental plan, again, based upon when you started Medicare. Again, before 1/1/2020, it's an F. After 1/1/2020, it'd be a G. No underwriting required when you make that move. All right, so the way that works is you actually would don't have to qualify, but we'd also have to pick out a drug plan for you, and then that drug plan would automatically knock out your Advantage plan. And the reason for you to be able to be eligible to do that is, again, this SEP. Those of you who are new to that, it means a special enrollment period or a special election period, a reason that you can do something outside the norm. And that's just simply a mover. You move 30 days before you move or 60 days after you move. You have the right, if you're leaving an Advantage plan, to get that supplemental plan. All right, that's the way it works. Let's keep going. All right, I'm receiving SSD, disability, and have to wait 2 years for Medicare. Will they notify me when I can sign up? Okay, Shirley, you won't have to sign up. You will be automatically enrolled into Medicare on the 25th month of having received your Social Security disability benefits. So whenever those start, the 25th month, your Medicare A and B will begin, and they actually will mail you an A and B card about 100 days, 3.5 months prior to your that 25th month. So I don't know how old you are, but it'll be on that 25th month you begin Medicare, and they always mail you the card that 100 days in advance of that date. Okay, so you don't have to do a thing. Automatically enrolled. All right, who's next? All right. Why are you Blues Brothers? Oh, very good. Thanks for asking. Okay. I've mentioned this twice. You're probably new, but just signed on. I had a retina detached last Thursday. I had surgery. So I'm a week into it. And I'm really doing well. I had my doc's appointment today, and the retina is reattaching. If you've ever been through this, you know they put gas in there as part of the healing mechanism. So I have a gas bubble in my right eye, and I went in today for a checkup, and they dilated both eyes, and so everything is bright as can be. So I wouldn't even be able to see the screen hardly if I didn't have these glasses on, so thanks for enduring that, but that's why. All righty, will Medigap plan premiums increase after October 1, 2025? Not necessarily. Medigap premiums typically increase at the anniversary of your policy. Now, if you started your Medigap policy October 1 of 2024, then yes, that would happen, but that's only coincidental. Medigap policies are usually tied to the effective date. There's one carrier, United Healthcare, that actually you have actually two increases with them annually. You could have a birthday increase, and then you could have a group increase, and they take those at separate times of the year. But as a general rule, Medigap policy increases have nothing at all to do with this annual enrollment period that we're getting ready to go into. This annual enrollment period, October 15th to December 7th, is all about Advantage plans and prescription drug plans, not supplemental plans. Okay? All right, let's keep going. Here we go. Excess of the CMS rate or 15% of what was not covered. Okay, you're right. So what that means is not 15% of what was not covered. What this means is there's a doctor that you went to see that is a non-assignment doctor. They are not under a contract where they're obligated to take the Medicare reimbursement rates as payment in full. Okay, so again, the doc says, no, I take Medicare patients, but I don't take Medicare reimbursement payment in full. They add to the bill. So whatever that bill is, they're going to add 15% to that, and then you would be responsible to pay for that. Unless you had coverage for that, which would be a G plan or an F plan. N plan doesn't cover excess. So it's when a doc adds to the bill. It does not happen often. Most doctors are what we call participating physicians. They participate in that fee-for-service schedule. They agree to take the reimbursement rates as payment in full. They don't add to the bill. But when they don't have that contract, they can still see you, but they're going to upcharge at 15%. And you've got to pay for it. All right, does G or N plan cover prescription drugs? Well, only those that are professionally administered. Okay? And A and B will pay for meds, inpatient, outpatient. and therefore your supplemental plan will also. But for the meds you self-administer, your blood pressure, cholesterol medication, insulin, those kinds of things that you self-administer, those are covered through drug plans. Okay, those are called Part D plans. So the answer to your question is yes, but not self-administered meds. All right, if on an in-plan excess charge examples, can hospital or outpatient surgery have excess or only doctors? Only doctors, that's it. No one else. Hospitals cannot do it. Outpatient clinics cannot do it. Now the doctor could. That is in a hospital. They could for sure. A surgeon could do it. Anesthesiologists could do it. So all the doctors can, whether in or outpatient. But the hospital itself, for its room and board and nursing services, facility fees, they cannot upcharge those. Durable medical equipment providers cannot either. So your outpatient facilities could not do it either, but the outpatient docs could. Okay. All right, next. I have Plan G, so I don't have to pay for copay on doctor's visits, and that is exactly right. Maria, the only thing you have out of pocket on a G plan is the annual Part B deductible. So what happens is the first $257 this year that came to the B of Medicare, all outpatient services, doctor visits, everything that's on the B side, you have to pay the first $257. Let's say your first claim is cataract surgery. Well, it's going to cost you $257, and then now you've met your deductible, you're done for the year. All right, so doctor visits per se do not have, you don't have to have a copay for those, but you would have to pay the first $257 of anything on that B side, which also includes doctor visits. Okay. Hopefully that made sense. All right, Leo, new to Medicare and about 2 years away from retirement. How many letter plans are there? G and N only. Those are the ones I hear most about. Okay, well, there are actually 10. There's Medigap A, B, C, D, F, G, K, L, M, and N. Okay, so there is 10 of those. Now, if you're starting Medicare after 1/1/2020, you can't get a Medigap C or F plan, but you have the other 8 that are options. And then they also have what's called a high deductible plan F or a high deductible plan G, where you have to meet a deductible before the plan pays anything. And so the reason that you hear most about G or N is because that's the ones that most people take. And there's good reason for that. They just seem to make more sense. There's a lot of competition, so the prices are very reasonable. And so that's why most would do G or N. That's what I'm going to do. Okay? Okay, let's keep going. Jeff, you touched on this Monday. When I sign up for my SUP, can I be assured that the insurance company is placing me in a very new group so that the majority of people are age 65 and maybe slightly more healthy? Absolutely. Yeah, because what happens is once you enroll into a plan, you're going into that plan's newest group. They're not going to stick you in some older group. You could be 75. You're still going in. If you're setting up a new plan, you're going to be with primarily people that are 65 or that are retiring, coming off work plans that are 67. So normally a newer group is not only larger, but also going to be healthier. All right, Kim, did he say that right? I thought Advantage Plan was HMO, not a PPO. No, Advantage plans could be either an HMO or a PPO. This year, 2025, it's about probably maybe 50-50 or 60% HMO, 40% PPO. But next year, 2026, that's going to change. We're going to see fewer and fewer PPO plans. The companies cannot control the finances on those as much as they can on an HMO, and they've lost a lot of money on PPO plans. So as we go into 2026, there are going to be a lot of PPO plans that are going to be dropped. Now, there'll still be some that'll be available, but the great majority of the plans next year will be HMO plans. Kind of more restrictive networks, and they can control the cost on those, and the companies have to make a profit. And so that's why you'll see that switch. So again, when it comes to Medicare supplemental plans, there are no networks. We call that open access. But Advantage plans, either HMO or PPO, and they also have one called HMO POS. it's an HMO plan, but they give you a point of service option, meaning you can go out of the network at certain times. It costs you more to do it, but you have the right to do it. Typically, in HMO, you can't go out of a network unless it's emergency or urgent care. You're confined to the network. A PPO, you can go outside the network. It just costs you more. And so the HMO POS is kind of in between. It's still an HMO network, but you have the point of service right to go out of network. Again, just costs you more to do it. All right, let's keep going. Okay, if all the insurance companies have to follow the Medicare rules, why are they charging different premiums since they all have to follow the rules? Why would everyone just go with the cheapest? Well, first off, the way insurance works, whether that's your homeowner's insurance, your automobile insurance, there's a lot of competition, a variety of companies that offer those policies. So that competition within the market really dictates what these prices are going to be. Medicare sets the rules for what's going to be paid, but Medicare doesn't set the premiums. So the free market system does that. And so what happens is the companies get to set their own premiums based upon their profit margins, maybe their claim history. In other words, whatever's going on within that company, they have to decide what kind of margin they want. So they set the premiums. So again, Medicare sets the rules for payment, but the plan set the premiums. And again, just like your home, I don't sell homeowners insurance or automobile insurance. I don't do that. But I do know this. I could take someone's home and, it's the same age of home, same age of the roof, same condition of the home. And you could get 5 or 6 different quotes from different companies, State Farm, Geico, American Family, Allstate, whoever. I guarantee you there's going to be different premiums. Same house, same roof, same everything else, but different premiums because those companies go after certain markets and want different margins. Automobile, same way. You're not going to get the same premiums for your automobile quotes. They're going to vary. And that same thing with health insurance because companies get to decide that. All right. Then you said about the cheapest. Sometimes the cheapest is the best, but we don't just look at initial premium. I want to look at the stability of the rates of that company. And we look back the last 10 years for companies that will actually report, and we can see how stable they've been in the last 10 years. It gives you some kind of indication as the stability of the rates, because sometimes companies will lowball, and they have a history of doing that, and then they start bumping the rates up faster. And so you got to pay attention to details like that. So cheapest may be best, but it may be worst if you're going with a company that kind of plays those games by being lowball because they know they can raise prices once they start losing money. All right, I'm ready. Wanda, you guys, Medicare score awesome. Well, thanks for the encouragement. I was confused before I spoke to one of your people. So patient, took the time to explain everything in detail for me. Hey, all right, I'm glad, Wanda. It's our privilege to serve as your broker, and I'm glad you had a good experience. 99% of the time, that's what happens. Every now and then, we'll drop the ball. We're not perfect, but we really do strive every day to provide great service and to be honest and operate with integrity. So I want to appreciate the encouragement, your words to us. Appreciate it. Okay, Daniel, who's next? Charlie, can you provide examples of excess charges I may come across on the end plan? I'm thinking back, surgery, shoulder surgery, nips, heat. Okay, for future, I have no problems now. All right, so first off, remember, only doctors can do this. Primary care doctors, specialists, surgeons, anesthesiologists. And so those are the docs that can actually add to the bill. And as I said earlier, it happens, there's less than 5% of doctors that can even do it because 95% of doctors are under a contract that won't let them do it. And so those that are less than 5% don't always even charge excess when they could. Okay, but that's the point. So as far as examples, it's only going to be physician services. And again, a primary care doctor, why are they going to waste their time on that? Truly. I mean, so maybe they get $80 on a Medicare visit, and so to add 15% to that, I mean, $12. That's not going to happen. Where you're going to see this are typically in your specialty fields of cancer and different things where doctors are paid more, where there's a lot of technology, and those doctors groups say we just can't operate with what Medicare pays. We're going to have add the extra 15%. So again, that's the kind of things you're talking about. Just your average everyday primary care doctor, even a specialist visit, probably not going to happen. It's going to be in those more high dollar fields when they're going to add the 15%. And when it happens, you're going to have to pay for that. Now, here's the thing. There's 8 states that don't even allow it, period. And then if they do charge excess, that doctor has to let you know that. All right, so it should never take you by surprise because they have to give advance notice of it. All right, let's keep going. All right, does Part B or Plan G cover your medical while travel abroad? No. Now, what will happen when I say no, I'm talking about Medicare Part B. Outside the U.S. or the U.S. territories, you have no coverage for Medicare at all. Now, what happens with your Plan G, and this would be the same thing with a Plan N, is that company has to give you $50,000 worth of foreign travel emergency benefits. $50,000 foreign travel emergency. So again, we're outside the U.S., we're outside the U.S. territories, no Medicare coverage, and this is one time when a plan will pay. And the way that coverage works, number one, it's a lifetime $50,000. It doesn't replenish itself if you use it all. And so you have a claim. Let's say you have a $10,000 claim overseas. I had a lady fall in Australia. Claims about $8,000. And so the way it works, she had to pay a $250 deductible, and then her G plan paid 80% of the balance, and she had to pay 20% of the balance. I had a lady that almost died actually in Ireland on vacation. Something happened with her liver, $172,000 bill. Well, the plan paid $50,000. That was it. So again, it's 80-20, but their 80% from the insurance company stops at $50,000. Your responsibility would be the 20% up to that point. Okay? Hope that helps. And then again, they don't replenish it. It's a lifetime benefit. That's why you get travel health insurance, by the way. Get travel health insurance. I have AARP, United Healthcare for my Plan G. Do I need to contact you all and re-enroll? No. Your Plan G, with any carrier, whether it's Aetna, United Healthcare, Humana, whoever, it doesn't matter. All supplemental plans continue to automatically renew as you make your monthly premium. So you don't have to contact us. I'm happy to contact us if you want to. We're happy to reshop rates and do whatever you need to do. But as far as the plan itself, it is a lifetime plan. You pay your premium, you're done. And historically, United Healthcare has been very stable. They have taken some pretty hefty price increases here the last couple of years. But for years and years, they were one of the most stable companies in the market. And I think we're going to see them kind of return to that as well. But there's other good companies out there that are also stable. Okay? So hope that helps. But you don't have to contact anybody. It will continue to renew. All righty, when is the time that I can switch to the supplemental plan? What are the requirements to do that, please? Okay, well, first off, I don't know where you live, but in most states, not all states, but in most states, you can move your supplemental plan anytime you want to, but you have to go through underwriting to do that. Got it? So again, once you've been on your supplemental plan over 6 months of your Medicare B date, because those first 6 months of your B date, there's no underwriting. They have to issue the policy. But after 6 months of your B date, so now you're on it for a year, 2 years, 5 years, whatever, and you want to get off the supplemental plan and switch to a different company or a different plan, then in most states you have to go through medical underwriting. Okay, now, it could be possible that you live in a state where they have some special rules, very limited periods of time of the year, usually around your birthday, okay? And we call those birthday rule states. Let me try to name most of them. It would be New York, Oregon, Washington's actually year-round for this, not necessarily birthday or year-round. You got Idaho, Nevada, Oklahoma, Louisiana, Illinois, Missouri. It's not birthday rule, it's anniversary, same concept. You have Kentucky, Maryland. I think those are the main ones that have birthday rules. And birthday rule just simply means you take your birthday, and some states it's 30 days before birthday, 30 days after. Some states it's from your birthday for the next 60 days, and you can change supplemental plans and usually companies, like to like or like to less, G to G or G to N. Or end to end, and you can change carriers to save money. And there's no underwriting during that window of time, again, called a birthday rule state. Okay, Missouri is anniversary. It's tied to the anniversary of the policy, not the birthday, but again, it's 30 days before, 30 days after. Washington would have that year-round. The state of New York, Connecticut, and Massachusetts never have any underwriting. You can switch those anytime that you want. So again, there's going to be a dozen or so states where they have special rules. The rest of the states, you have to medically qualify after 6 months, and you can do that anytime that you want. All right, great question. All right, I've heard that supplemental plans just keep increasing in cost and that one day you can't afford them. True or not? Well, that could happen for sure. They do go up in cost. And just so you know, you all, everything goes up in cost. Medicare Advantage plans, they may not raise their premium, but they raise their copays and they raise their max out-of-pocket. So everything goes up because of medical inflation. But it is true that they go up, and sometimes people come to a place where they just simply cannot afford them any longer. And then you have one option, that is to get a Medicare Advantage plan. And then you'll have to, of course, live with the consequences of that. If you're in rural America, that's very tough because there's not very many, if any, Medicare Advantage plans available. They can't make them work. They're not profitable because there's not enough people in an area. But if you're in a metropolitan area, then you can usually find an Advantage plan that will work for you. Again, we have to check your doctors and hospital choices and all that to make sure that plan is going to meet your needs. And it is true, some people end up having to no longer be able to afford this supplemental plan, and they'll go on Advantage. Okay. All righty, Gracie, my friend has an F plan. Monthly premium is very high. Can she switch to Plan G with same insurance company without going through underwriting in Virginia? All right. Yeah, I know Virginia just became a birthday rule state. And so you know what? I think it is like to like or like to less. So she should be able to do that, move to a G plan. Yeah, they just, in fact, I think they're brand new on that. In fact, there's somebody that just starts January 1, 2026. But I know Virginia is now a birthday rule state. Hey, Daniel, if you have a chance, maybe Google that. And let's see if it's like to like or like to less. If it's like to like, then she'd have to move F to F. But if it's like to like or like to less, she can move to a G plan. And Daniel, he will let us know here soon. All right, let's keep going. All right, how can you minimize any potential IRMA if you're about to turn 73 and have to take out an RMD? Well, your required minimum distributions you have to take, so there's really no way that you can minimize that unless what you can do, if you know you have to take the RMD, then try to manage the other distributions that you may be taking elsewhere. Because if you're single, we got to keep that below 106,000. If you're married filing a joint return, we got to keep it below 212,000. So depending on how large your RMD is, then there may be no way to avoid the IRMA. And again, it's just year to year to year. And I know they're painful, but it's still a great problem to have. Because you have very high income, and that's that's nice. They're not going to take all of it, and I'm not trying to minimize IRMAs. I hate them also, but the point is it's still a very good problem to have. But the only way to do that is to minimize other investments or other income that you're taking, because the RMDs have to come out for sure. All right, let's keep going. All right, I know Medicare does not cover much eye-wise. Concerned that a small skin growth below an eye is creeping too close to an eye. If my dermatology agrees, does Medicare cover this? Oh, yeah. Okay, so let's talk about it. First off, Medicare covers great eye-wise. Okay? There's only two things that Medicare will not cover with your eyes. They will not pay for non-medically necessary eye exams. I'll say it again. They will not cover non-medically necessary eye exams. They won't cover that, and they will not pay for eyewear unless it's after cataract surgery. Okay, so those are the only two things Medicare will not cover. Now, if I have a medically necessary eye exam, doc, I'm seeing floaties, my vision's altered, something, that's covered by Medicare. So Medicare covers very good glaucoma, cataract surgery, macular degeneration, all these things Medicare covers very well. All right. And so as far as this skin growth, this tag, if it is medically necessary to remove that because it could, bring difficulty to your vision or whatever, and the doc says, hey, this is covered by Medicare, then they're going to cover it, no problem. And if you have a supplemental plan G or a supplemental plan N, it'll pick up the 20% coinsurance as well after you've met your deductible. Okay. So I just want to make sure you know Medicare really does cover well for eyes. I just had this retina detachment. I'm not on Medicare. I don't go until January. but it would have covered it very, very well. So it's great coverage. All right, let's keep going. All right, I'm an ARP. My premium has gone up about $75. Are there any options for me to stay on G plan with lower premiums on California? Well, maybe. What I encourage you to do is call in. You see the number on the screen, and just ask to speak to one of our agents, and they can tell you other rates in California. All right. And if you're around your birthday, you can do that with no underwriting. I think the birthday rule in California is, I think it's 30 days before and 90 days after your birthday, somewhere that period of time. So just call in the number, toll-free number, and the agents can tell you exactly what your options will be. All right. What are the changes coming for deductibles in 2026, please? Okay, well, the only deductible that we know of for sure right now would be the Medicare Part D, the drug deductible. This year it's $590. It's going to $615. And that's the max deductible the drug plan can set. But we do not know yet the Medicare A and B deductibles. Those have not been published. They should be published sometime toward the end of October, first part of November range, but we don't know yet. Just the D deductible. $615 is going to. All right, let's keep going. All right. All right, for those of you joining, let me explain the glasses again. I had a retina detachment surgery a week ago, and doing great. I repaired it, but they dilated my eyes today for a checkup, and I cannot see anything hardly. Anyways, that's the purpose. So, okay, the future is so bright, you got to wear shades. Oh, okay, very good. Good timing. Yeah, that was quite an ordeal. In fact, I was actually out of the country. I was in Germany on vacation when this happened, and they wanted to operate on me in Germany, but you can't fly for 4 weeks. So my wife and I were on a plane in less than 24 hours back to the U.S. to have this surgery done for me. So it was quite an ordeal. We were just scheduled to go on our very first ever river cruise and did not get to do it. We were going to go through Germany and Hungary, and anyway, so it didn't happen. So just another day. Okay, let's keep going. Okay, after enrollment A and B, do you have a 6-month window to apply for both Medigap plan and a G plan? Okay, yes. Well, Medigap plan and a G plan are the same. Medigap plans include G and N. And so you're right, you do have this 6-month window, and it's tied to your B date. So let's say your B date was this next month, October 1. You would have all of October, November, December, January, February, and March. 6 months, including your birth month, to get a Medigap policy with no underwriting at all. The insurance companies have to write you. They have to cover your pre-existing conditions. No health questions asked, no med checks, nothing. They'll cover you for sure. But after 6 months of that B date, unless you live in New York, Connecticut, or Massachusetts, you will only get a MedSup plan by qualifying. You've got to qualify to get a Medigap plan after that. And so now I encourage people not to even use the 6 months, because you can, for sure, but I would encourage people to do it in advance. I turned 65 in January, and I'm going to apply after October 1, because you can do it anywhere from 3 to 6 months depending upon the state that you live in. So most people do it 3 to 6 months in advance of their B date. Now, the policy doesn't start until your B date starts, but you can get all set up so you're ready to go. So once your B begins, you also have that supplemental plan to cover all those gaps in case something were to happen. But you do have officially 6 months of the B date. Okay. Next. Dean, can you guarantee us the best premium? What I can guarantee you is for the companies that we write, which are almost all the national carriers, we can quote all those premiums when we're talking to you. Okay, so I can tell you what the best premium is based upon who we write for and that particular day. Insurance companies have the right to raise rates, new rates, new business anytime they want to, and that varies. So yeah, I can guarantee you that we'll give you the best that we have available at that time. But let's say someone is going to not start Medicare until March of next year, and they get a rate today. Well, if they don't lock that rate in and get it all set up, then that rate could change between now and March. It just could. So I'm cautious to say I can guarantee. I can guarantee that we'll be truthful with you and accurate with you when we're setting everything up. And once you've applied, then they'll actually lock that rate in for the next 12 months. Okay, that can happen for sure. All right, let's keep going. Lisa, we have a supplemental plan in Georgia, moving to Alabama next week. Is there anything we need to do? Okay, Lisa, here's what's going to happen. Number one, both of those markets are going to be very similar. And so you're going to take your G plan with you. When you notify the Postal Service that you have a change of address, then what happens is the Postal Service notifies Medicare, which will in turn also notify your supplemental company and your drug plan and let them know that you've moved. Now, your drug plan, you're going to have to switch that for sure. And you can do it 30 days before you move, 60 days after you move. So that window. But your supplemental plan, you take with you. But when you get to Alabama, that insurance company has the right to adjust your rate if rates are higher in Alabama. And I'm saying to you, they're probably not going to be. Probably going to be very, very similar. But that's the only thing that can change when you move supplemental plans. Insurance company has the right to re-rate you based upon what's normal and customary in the market that you've moved to. And I've had people move all over the place. I've never had anyone cancel a policy because of some rate increase. I've even seen them go down before as well. And so that can happen. All right, so it will. And you can call them in advance if you want to, Lisa, and let them know you're moving. And they'll tell you exactly how they're going to handle that. But they'll also find out about it too because Medicare notifies them. Okay. And also, listen, when you make a move like that, be sure if you change banks, because I'm sure you're paying through a bank draft, be sure to let them know your new routing number and account number if indeed you are changing banks. It's important. I've had people mess that up before and lose their policies. All right. Hi, Marvin. Currently on a SUP. In New York, as a New York resident, so I have a house in Florida. Can I change to a Plan G in Florida rather than New York since the premiums are lower in Florida? Okay, so here's the way it works. They're going to ask you, where do you reside the most, meaning 6 months in 1 day. 6 months in 1 day. So if that's Florida, then you would have the right to be able to be rated in Florida. And actually, those two states are very unique. They kind of have some of their own rules. But you should be able to get the Florida rate. And again, I would call the insurance company and let them know what you're doing. But I guarantee you, they're going to say, well, do you live in Florida more than you live in New York? And if that's really the truth, and you're there 6 months in 1 day, then you can count the Florida as your residence. And it should be cheaper for sure. Now, rates are on SUPs are kind of, decently high in Florida as well. It's not one of the lowest markets, but it's definitely going to be better than New York. All right. Let's keep going. Maria, I have Plan GR, Healthcare this year. They adjusted premium twice. That's kind of set me off budget. Is that normal? Maria, it is. Let me tell you why. Because what happens is United Healthcare in almost every state, when you first start the policy, has what they call an enrollment discount. And that enrollment discount varies, but on average, it's about 39%. So what they do is they take the rate of, I think it's an 82 or 85-year-old person, and they discount that 39% when you start Medicare at 65, anywhere between 65 to 68. So they discounted that quite heavily. And then what happens, once you reach 68, and now you're 69, they start removing that enrollment discount 3% a year. All right? And so that happens typically around your birthday when they remove that 3% discount every year right around your birthday. So that is one price increase. It's really just you've lost 3% of the enrollment discount. The second price increase normally happens in the spring of the year, and that is when they take a group increase. That means everybody in the group, regardless of gender, regardless of age, they're going to take an increase because that group is losing money. Now, maybe the group's losing 3% or 5% or 10%. So that's when you see that other increase. And if the group didn't lose any money, the only increase you would have seen is once in the year, and that would have been that 3% enrollment discount that was removed. All right, so there's two types of increases. Enrollment discount losing every year, and then the possibility of a group increase. Okay, that's what happens. And I hate the way they do it that way. I don't hate them. I think they're a fine company, but it's just the way they do business. All right. Sue, I was new to Medicare this past year. Do I need to find a new dental supplement? I really like the one I have now. I know I need a new RX. Okay, no, if you have a dental plan that you're happy with, yeah, dental plans are automatically renewable. You just keep paying your premium, and there's nothing you have to do unless that dental plan is going away. And I honestly have never heard of that. So most of the dental plans have been around for years and years. So if you like it, keep it. And yes, as far as your drug plan, if your drug plan is being dropped or it's no longer attractive, then yes, you'll need to make sure that you find a new drug plan between October 15th and December 7th. And remember, that new plan will automatically kick out your old plan effective January 1. Hey, folks, my back is killing me. Hang on just a second. I am going to move my stand-up desk down. I've been standing too much today. Okay. I'm good to go. I just want to sit down. Okay, I'm ready. Shelby, remind us what the name of the travel insurance company you recommend. Okay, I have used a company called Travel Health Insurance Center. Now, I will tell you that I just told you I just had this trip, and I got some through them, but boy, they were tough to reach. I think they're kind of understaffed. So I had a fellow ask me the other day, and I also have used in the past American Express. I went to Israel, and they were very attractive on that trip. Okay, hang on just a second. Okay, Daniel, I see that. I'll be careful. Okay, so Travel Health Insurance Center. And if I could see, I will give you the phone number. And again, I had a hard time getting through. So, and I have nothing to do with this company. I just used them before, and they're brokers, so I like that. They actually shop rates, but boy, I had a hard time getting through. I had to call several times and finally got it. Well, you all, there it is, Travel Insurance Center. Here you go. Here's the number. It is 866-979-6753. 866-979-6753. I've used them. And then American Express, I've used them. I assume they're probably still writing travel insurance. I'll give you that number, 800-228-6855. I think that's right. Yeah, 800-228-6855. All right, my vision's terrible. All right, let's keep going. Irene, my doctor told me Medicare won't cover an MRI for my knee pain unless a sports medicine doctor orders it. I have Supplemental Plan G. Is that true? Also in that case, a sports med doc may upcharge the 15%. Yeah, what is true about a doctor adding the 15%? Irene, I've never been told that, ever. Okay, at all. And so I would, surely that's coming from a primary care doctor. I would say if you're seeing an orthopedic doctor, then they should know what is necessary to get the MRI covered. I could see where a primary care doctor may not know what's required. So you need to see an orthopedic doctor. I've never heard like a sports medicine doctor. Well, maybe that's who you're referring to. But I could see where Medicare would want an orthopedic doctor to order the prescription for an MRI. That would make sense to me. And so you have Supplemental Plan G, so they'll never interfere. They'll cover if Medicare does. And then you can ask that orthopedic doctor if they charge excess. That's the way you would want to do that. And again, remember, the likelihood is very, very small, but it never hurts to ask to make sure. But you have a G plan, so it won't matter anyways, because the G will cover your excess if that occurs. So you're fine. You only have to ask them, because they charge it, G pays it. All right, next. How does one compare Part G plans to find something less expensive? Okay, well, there's a couple things you can do. Number one, you can call in and talk to one of our agents. Happy to do it. We also have a site that we use. We own this called Medigap Compare. Daniel just put it on the screen right there. And this is a very, very good tool. Go in there, give them your age, your zip code, no other personal information, and it'll actually shop the different carriers in your market and let you know where rates are. And then if you want further clarification, call in, talk to us, or you actually can enroll right there on that site. If you see something that you like, it goes through the underwriting questions, and it's really a great tool. We own that site, so feel free to use it. Medigapcompare.com. Okay, who's next? What does medical underwriting entail? Okay, great question, Cheryl. What that means is that we ask you about, maybe 35 or 40 different health questions. You don't have to get a physical or draw blood or anything like that. It just simply means that as the agent, we have to do what we call field underwriting. We have to, in the field, we're talking to you over the phone or face to face. We're going to ask you about 35, 40 health questions. And those are some of your big things. We're going to ask you details about your heart, your lung, your liver, your kidney, cancer, diabetes, things like that. And find out if you have rheumatoid arthritis or spinal stenosis or psoriatic arthritis and a variety of things. So those are the health questions, just trying to find out what conditions you have. Now, some of those health questions say, have you ever in your life had this? And if you do, you're declined. Others of those say in the last 2 years, have you had this? And if you do, you're declined. So someone that's had cancer 10 years ago, it won't matter. They're not going to be declined for that. Somebody that just got diagnosed with AFib, that's a problem. Someone that's an insulin-dependent diabetic that takes more than 50 units of insulin a day, that's a problem. Someone that has osteoporosis, they've had fractures, that's a problem. So that's what I mean. So we're going to ask a variety of different health questions, looking at different organs, heart, lung, liver, kidney, neurological stuff, just different items. We have one care they'll say, have you been diagnosed with depression and you take medications for it and you've been taking those meds for 2 or more years? If so, they'll decline you. So it just varies carrier to carrier. Some companies ask us height and weight. So when people are overweight and substantially, then they may get declined for that. We have other carriers that don't ask height and weight. They'll take you. It doesn't matter about body mass whatsoever. So as a broker, we kind of know what companies will take and won't take, and then we try to find a carrier that we can get approved through underwriting. All right. So we check your meds as well. Whatever meds you're taking. Some meds, they'll automatically decline. I can assure you someone that's taking Aricept for dementia or Alzheimer's, they're going to be declined just because of that medication. Okay? That's what underwriting means. We take that information, give it to the insurance company, and now they are going to make that final decision. But remember, folks, 6 months of your B date, they can never make you go through underwriting, ever. You live in New York, Connecticut, or Massachusetts, no underwriting in those states either. So 6 months of the B date, they have to approve you. That's why it's important to get that Med Sup plan initially in case your health were to change if you can afford it. All right, Plan F, and my PCP told me that Medicare starting 26 now allows for admin charges. He wanted me to fill paperwork. Should I fill? Well, that's really interesting. Okay. Well, in the past, that is news to me. I'm going to have to check into that because in the past, part of the Medicare contract was, the assignment contract was they could not charge for billing at all. So those admin charges, I'm getting the impression from you that doctor said that you had to pay for those. I don't think it works that way at all. I've never heard that. We're going to have to check into that. So if I were you, I mean, if the government's allowing that, I would suspect that Medicare is going to cover that. I don't think that's going to be something passed off onto you. So, I don't know. That's just news to me. I'm really sorry. Well, but Daniel, definitely let's make a note of that and find out if that really is true, because that didn't make sense. Not that they could charge you admin charges to file, because the whole Medicare assignment contract is they have to take Medicare approved reimbursement rates, and they have to file the paperwork. They cannot bill you until after Medicare has paid them. That's a series of requirements within the Medicare assignment contract. So that's news to me. Let's keep going. All right, Wayne, Aetna Silver Script Choice is leaving my Tulsa, Oklahoma area. I was just notified that is must get a new Part D plan. Good. Is this a life event? There's no underwriting to change RX plans. Okay, Wayne, it is not a life event, but you don't have to worry about underwriting when it comes to drug plans. They are guaranteed issue products. So whatever drug plans are available in your zip code, you can have it. So never underwriting for drug plans at all. So you just have to get a new one. So the plan you're on, the Silver Script plan, is will be yours through 12/31. So you have that October 15th to December 7th window to switch those plans. Okay. Next. All right. Should I interview all medical staff to ensure they accept Medicare if I end up in the hospital? No, you don't have to. So as long as the hospital takes Medicare, and they do, then everything that's done by those doctors, by those people in the hospital, are also going to accept Medicare. Okay. Now, if you have surgery and the surgeon adds excess, then they have to tell you that in advance. I think you have to sign off on knowing that there is excess. Okay, but you don't have to go through and worry about all the staff. All hospitals take Medicare. 99% of all non-pediatric doctors take Medicare. Okay, so don't burden yourself with that. I promise you, not necessary. Okay, call Medicare about the birthday rule in my state. The person at Medicare didn't know what I was calling about. Well, that's not shocking for sure. Because really it's more of a supplemental type of a rule that states impose. So it wouldn't surprise me that people within the Medicare claims would know that. Nad, where do you live? Maybe you could let us know that. And then if you did, let us know that we could talk about the birthday rules. But it's really easy you can chat GPT those or Google those and tell them the state. Just ask, does my state have a birthday rule? And they'll let you know. Like I said, there's about a dozen or so states that have it. All right, let's keep going. If I sell my house, do I pay IRMA starting the month I sold, or will they automatically charge me for the whole year? Okay, first off, when you sell your house, if you're single and you, of course, qualify, you've been in the home more than 2 years and owned it and occupied it within that period of time, then you have actually a exclusion. $250 for single, $500,000 for a married couple. And again, not everyone gets an exclusion, but that's the first thing I would check into. Do you have an exclusion? And so if you don't have an exclusion or you're above those amounts, then what happens is if you sell your house this year in 2025, that will not show up until 2027. Because they always base the IRMAs on income 2 years prior. So this year, 2025, they've been looking back at 2023 income. So in 2025, if you sell your home, that will affect you in 2027. Okay? So, and you're right, they will automatically charge you unless you appeal. And you can't appeal an IRMA because you sold the house. But if you happen to sell your house and then you retire around the same time, then you may have an appealable event. And you can look at this form online. It's called an SSA 44. SSA 44. And that's the form that you fill out to appeal an IRMA. And it'll give you 8 different life-changing events, which allows you to appeal an IRMA. Now, selling your home is not one of them, of course. I'm saying if you happen to sell your home around the same time when you happen to retire, then you could use your retirement as a life-changing event, and then therefore you could appeal the IRMA and they'll drop the IRMA off. Okay? That's the way it works. But remember, you have an exclusion. Not everyone has to pay money on the gain from their house sale if they qualify for the exclusion. It will not appear at all and hurt you on your taxes. Okay, let's keep going. Rita, you can't just drop the supplemental and stay on regular Medicare if it gets too expensive. Why would you have to go to an MA plan? Well, Rita, I definitely would go to an MA plan if I had to drop my supplemental plan. And I'm going to tell you why. Because with original Medicare A and B, you have a tremendous amount of financial liability, a lot of gaps. The biggest one is the 20% coinsurance on the B side. You got hospital deductible, B deductible. You got copays for extended hospital stays, copays for extended skilled nursing stays, 20% coinsurance. You've got excess charges. So you got these gaps. And so if you drop your supplemental plan, you're now responsible for all the gaps. I would never do that. So I definitely think the second best option would be to do an Advantage plan because at least they stop somewhere. They have a max out of pocket. Original Medicare A and B does not have a max. Sky's the limit. You keep on going. So if someone can't afford a supp, then they ought to get an Advantage plan. A and B would not be an option in my wheelhouse whatsoever. Would never recommend someone do that, ever. All right, let's keep going. Once the application paper is submitted, how long should it take for your Plan B to be processed? Well, hey, Tim, it just depends on where you live. Some are processed in as little as 2 or 3 weeks, and some I've seen it take 6 to 8 weeks. And so I will tell you, Tim, they will honor your effective date. So let's say you requested effective date of November 1, and you don't get your card by then. They'll still honor that even if they're behind. They'll give you that date that you requested. Okay, but again, minimum 2 to 3 weeks, maximum, could be 6 to 8 weeks. Again, depending upon where you live. I know Texas right now is pretty slow, but I'd say average 4 weeks. Okay. All right, what plan will you enroll for? I knew someone was going to ask me that. I'm going to take a G plan. I start Medicare. I turn 65 in January, so in my market, there is one carrier that the difference is about $35, $40 a month between G and N, and so that's the carrier I'm going to go with. Yeah, I am. I'm going with the G. But by the way, if people go with an N, I do not think that's a bad decision for a second. I think it's a fine decision. I really do. The extra $40 I can afford, and so I'm going to get that. But if you said, hey, I'm going to save the $40 or $50 a month, then more power to you. Not a problem whatsoever at all. I think it's a great, great choice. All right, next. Danny, if I switch drug plans, do I have to notify my current plan of the change? And do I have to do that when I switch dental plans as well? Okay, well, yes, dental plans you should, because your dental plan is probably on some kind of a bank draft. So definitely one dental plan will not kick out another dental plan. So you want to do that for sure. But when it comes to drug plans, you don't have to notify them at all, because you can only be on one drug plan at a time. So when you make a switch, and again, it's only October 15th to December 7th, the plan that you select, once you've done the application, they'll get that approved by Medicare, and Medicare will automatically cancel your 2025 plan effective 1/1/2026. It just automatically knocks it out. Okay, you don't have to worry about it at all. That takes care of itself within the system, because, again, you can only be on one drug plan at a time. All right, Sharon, what Advantage plan can I change to a different Advantage company with no underwriting and open enrollment period? Oh, yes, you can. Yeah, no problem at all, because with Advantage plans, no underwriting ever. So as long as that Advantage plan is in your zip code, then you can move to the plan. And again, you can do that October 15th, December 7th, and Sharon will be happy to help you. Give us a call, and we can look at all the different Advantage plans in your market, look at networks, medications, the different perks within that Advantage plan, make sure that you're going to be on the right plan for you. All right, next. Ray, do Medicare Plan G cover cataract surgery? Yes. Yeah. If it was your first claim for the year, Ray, you would have to pay a deductible of $257 this year. Next year, I don't know what it'll be, maybe $270 or something, but it will cover cataract surgery other than the B deductible. Now, Ray, if you've already met your B deductible, then that's going to be covered at 100%. Now, let me add something. Medicare only pays for basic lenses, and that works for lots of people. But sometimes people want to upgrade and get a different type of lens, like a trifocal. That's what I have after cataract surgery, and yeah, that has to be out of your pocket. All right, but they will pay for basic lens. So if there's any upgrade, then that would be out of your pocket. And then Medicare also will pay for a new prescription, glasses after cataract surgery as well, at no cost to you. All right, great question, though, Ray. All right, okay, I guess that's it for tonight. Listen, we'll see you Monday at 5 o'clock. I'll have a Medicare Monday, and then next Thursday, same place, same time, 5 o'clock. Thanks so much for joining us. If we can help you in any way, folks, reach out to us. We're brokers. We'd be delighted to serve as your broker. No cost at all for our services. We'll do everything we can to make sure you're on the right plan and taken care of for the long term as well. Thanks a lot.